So early on in the pandemic, there were a lot of different possible treatments that were tried in order to stave off COVID-19. And look, this is also going on in a lot of different countries that don't have the vaccine. And this is something, of course, that's very concerning to health officials all over the world, considering that we do not have, at this point, equality of access to vaccines. So that's a gigantic problem where most of the vaccines are located in, the United States, Canada, Europe, etc., but not really anywhere else. And so you've seen previously to the vaccine, there are a lot of these different treatments that were tried here in the United States and other places. Some of them have had success. In fact, you had monoclonal antibodies, remdesivir. Those are two, I guess apparently decent treatments that we've had some success with. Others, however, that have been tried, specifically in the United States, have not been so successful. For example, colloidal silver, hydroxychloroquine, bleach, and of course, shoving light bulbs in your anus. These are all true. All been tried. Now, it turns out the best prevention is, well, prevention. Masking, social distancing. And then, of course, once the vaccine was available, getting the vaccine. Again, the best way to stop coronavirus is to not get it in the first place, if possible. So now, that said, the vaccine has been proven to work to making sure that you don't get seriously ill. And if you get sick, of course, that you stay out of the hospital. So that's good. That's generally, again, how it works. It reduces your chance of actually getting it. Although when there are breakthrough infections, it makes sure that you are able to fight off the virus well enough to keep you out of the hospital. So that's good. That's good. Yet for some reason, even though the vaccine, we are literally swimming in vaccines, Americans have avoided it. They've avoided it, even though it is free at the point of service, which is something that you almost never see in America. A medication actually free at the point of service makes me think that, oh, you know what? The smashing success of the vaccine being free at the point of service should be expanded to everyone, to everything, all these medications. The insulin, for example, is one of those things where you should absolutely get it free. EpiPens, same thing, life-saving medication, right? That said, there are a significant number of Americans that have, as I said, avoided the free vaccine and have resorted to getting fake cures shared on Facebook. So now, where is this coming from? I mean, it's not just rando people making these things up and spreading them around, right? Just regular people going viral. No, it seems a little too widespread, a little too sophisticated over on right-wing Facebook pages. So how is it possible that so much of disinformation has been spreading around? Well, we know. Follow the money. All about the money, of course. In fact, earlier this week, The Intercept released a damning report revealing that a prominent conservative organization has hooked up with healthcare providers in order to swindle people out of millions of dollars. So now, how did they do this? That's the question. Well, first, they used the aforementioned social media, conservative social media pages that will spread vaccine disinformation, okay? And then, of course, after people consume this disinformation, they will themselves become vaccine hesitant. And then after these people are vaccine hesitant, they look for other solutions, other cures. And what do you know? These companies are right there saying, don't worry, trust us. We've got the cures for you. And it's horse paste and it's, or horse pills or whatever. And then fish tank cleaner. From the report, one of the most prominent operations to scam the unvaccinated has been spearheaded by a group called the America's Frontline Doctors, which is an organization that is ostensibly that is pro-Trump, founded last summer by a conservative California doctor named Simone Gold. Simone Gold was also a Capitol rioter. Just Just letting you know about that. She was part of the Capitol riot. So now the group was funded, unsurprisingly, by the Tea Party. And they, of course, as I mentioned, their whole purpose was to help the Trump administration downplay the disaster of COVID and to really push for the reopening of the economy, the reopening of schools. And of course, the reason for that is not because they cared about the economy. No, it's because they want to push people back to work. That's the entire reason the Trump administration wanted to do so. Push people back to work, get the economy moving along. It doesn't matter how many people are dying. Just get the economy going again so that Trump can run on good economic numbers. That's it. That's really the entire political calculus here from the Republican Party is we really desperately want our numbers to go up. Therefore, we're just going to bank on good economy, but this dastardly virus and more like the mitigation for this virus has really put a damper in that. So now that same group, America's Frontline Doctors, also featured famously the demon sperm lady, Dr. Stella Emanuel, who says that women get, they have sex with demons in their dreams. Of course, obviously in their dreams, right? And that causes fertility problems somehow. She also claimed that we were being injected with alien DNA. Complete and total crank. She actually does run a clinic out of a strip mall. Oh, wonderful, wonderful. Now, other members of that group include 2 ophthalmologists, one that no longer even really practices, and other physicians that have gone all over conservative media to push hydroxychloroquine, and again, for reopening the economy faster. That is the thing, of course, that they all agree on. Now, according to hacked data sent by to The Intercept, 72,000 Americans paid America's Frontline Doctors $6.7 million for COVID-19 consultations from July 16th to September 12th. $6.7 million. Jesus. That's a lot of money. So now, per the hacked documents obtained by The Intercept, this is how the operation worked. Frontline Doctors referred its conservative audience to telemedicine partners speakwithanmd.com. Customers then paid $90 out of pocket for a telehealth consultation before they were prescribed this regimen, which was, again, not covered by insurance. So basically, what you have is a situation where they pay extra money out of pocket because, again, what insurance company is going to cover these cranks and pay for an unproven treatment? They're not. So now, the pills were reportedly sent to customers by another third-party company called Ravku that delivers medicine from pharmacies to people's homes. They describe themselves as an Uber of medicine, which, oh, great, that's exactly what we need. Great, fantastic. So now, it turns out there was a lot of people making a lot of money off of this. Big surprise, the hacker also provided records of 340,000 prescriptions that Ravku has filled between November 3rd, 2020 and September 11th, 2021, amounting to an estimated $8.5 million in drug costs, around half of which went to hydroxychloroquine or ivermectin, another 30% are for zinc and azithromycin or the Z-Pack. So all of this stuff, by the way, is, remember Joe Rogan. Joe Rogan says, oh, I got COVID, so I threw the kitchen sink at it. And so that's what he took. He took the zinc, the azithromycin, ivermectin, the monoclonal antibodies, which actually do work. Those are effective. And then threw effective stuff in with the non-effective stuff, and then came out later and said, it was the ivermectin. Thank you, modern medical science. And this guy has millions of views, by the way. So affecting millions and millions of people, his voice actually carries weight. Disastrous. And again, it's because he's wrong. If he was factually correct, well, I would give him credit for that. But he's not. He's wrong. So now, let's see. They also, as I said, speak with an MD physicians. have prescribed all these different drugs, and America's Frontline Doctors claims that it trains these people in order to dispense these medications that generally don't work on COVID-19. And then they pocket your money, even though you can go and get a free vaccine at the point of service. So it doesn't make any point. And by the way, people have died as a result of taking these medications, either from side effects or just getting COVID-19. For example, cardiologists have warned that hydroxychloroquine taken with azithromycin increases the risk of dangerous irregular heartbeats that could end up being fatal. The CDC advised people also not to take ivermectin, saying that it could cause severe illness, especially if, and as we've seen with some people who go out and, since they can't get a prescription, go out and buy the animal version and misdose themselves. So they'll take too big of a dose for a human being and then end up sick and then end up in the hospital anyway. And then later on, they end up getting COVID. If only they had gotten a vaccine. And by the way, when they get COVID, they have got no antibodies to fight it. That's why, unfortunately, thanks to the Delta variant, you have 99% of all the COVID deaths coming from unvaccinated people. If only they had actually gotten the vaccines. It's weird. But it gets worse. The physicians already know that they're prescribing fake cures to people. Why? I mean, how do I know that, right? Well, according to the hacks, it's because they make people sign a disclaimer so that they don't get sued when something bad happens. In fact, one physician included this disclaimer in their consultation notes with several patients, saying, I, physician's name, have a complete understanding of the recent release from the WHO, FDA, CDC, and NIH on March 5th, 2021, as it pertains to the use and prescribing of hydroxychloroquine and ivermectin. I understand that these two medications have been deemed highly not recommended by the aforementioned medical governing bodies, but are not illegal to prescribe. I have explained that I will not be held legally or medically responsible for an adverse reaction by this patient should they choose to take them, and have explained that they will not be able to hold me medically neglectful, pursue any form of malpractice, nor any criminal and civil lawsuits. So in order to get this, they have to have that waiver. And of course, they're getting paid for this too. I don't remember having to pay or get a waiver to get my COVID vaccine. Weird. Real strange. It's almost as if this is about the money. That they know that they can cultivate a bunch of gullible dupes in order to empty their pockets. A scam, for a scam that can literally kill them. You ever notice too, by the way, it's the same type of people. So they looked at the demographics of the people affected by this hack, okay? Or I should say on the record for this, who have actually ordered this and went through these telehealth services. So they found out the demographics, and even though they did service people of all different age ranges, generally they tend to be 60 plus. So you're talking older people, which generally tend to be more conservative, watch Fox News, get memes from right-wing Facebook groups, and also believe in other conspiracies. These people are unanimously targeted by bad actors because those bad actors see them as easy marks. And generally they tend to be. Now, another part of this is people who have lost trust in institutions. Now, let me be clear. I'm wary of some of our institutions, of course. Law enforcement, for example. Pretty wary of law enforcement. Pretty wary of some of our political institutions. But understand that context does matter. So when you look at certain things, when you look at certain actions, when you look at certain motivations, et cetera, you tend to understand who to trust if you use a little critical thinking, right? It's not just blind trust of institutions. It has to be, I should say, based on certain factors, critical thinking, again, being one of them. And so when you look at the pandemic, pandemics are pretty bad for countries. That's It's not good for businesses. It's not good for the economy. It's not good for anybody if you have a pandemic that goes unchecked. I think we can all agree that generally bad. So now it turns out the status quo is actually a lot better for business than anything else. And what I mean by the status quo, for example, before the pandemic, what were all these big pharmaceutical companies doing? They were gouging people on things like insulin and other medications, EpiPens, etc., or biologics. These expensive medications that are generally pretty specialized that they can really jack up the price on. So that's where their profit, understand this is where profit margins from pharmaceutical companies come from. They don't come from vaccines. They don't make the majority of their money from vaccines. And so, I mean, that's part of it, okay? So now, as I said, if you have an out-of-control pandemic, that's terrible for business, terrible for profit margins. If you kill everybody, nobody's going to be around to buy your expensive treatments. And understand that the virus can affect any one of us. So, as I said, there is an understandable distrust in institutions. I get it. But at the same time, don't be so distrustful of certain institutions that you will fall for grifters, unscrupulous actors who will definitely take advantage of your distrust and lead you astray. Again, and sell you, in some cases, literal snake oil. You have to use critical thinking. You have to be able to understand motives, and you also have to understand science, at least the very basics. If you enjoyed this video, please give us a like and share with your friends. You can subscribe and help out the channel by becoming a patron. It's patreon.com/Jeff Waldorf, or you can become a channel member as well by hitting the join button below.